Hello. Thank you so much for tuning in today. I have a topic that I've never discussed before that I want to talk about today. And this all stemmed from a few comments that I received on a social media post recently. The post was all about the importance of resting and specifically resting when you're exercising and not pushing to that point of fatigue. Or if you do push to the point of fatigue, just a little bit and not too much beyond that. And for the most part, the majority of people were responding saying, "Oh my gosh, yes, you've talked about this a lot. And I started implementing it, and I've seen better results, and I'm walking better. I have better stamina and endurance, and all these great things." But there were two people in particular that had a comment that was basically like, "Whoa, whoa, whoa, back up a sec. What are you talking about? I'm doing a program that enforces muscle failure. So you're basically saying the opposite. Why is that?" And this is such a good conversation to be having. And just to be totally upfront, I don't know what program they are doing. I don't know who the trainer or guide of that program is, but I wanted to share the research with you on exactly what the evidence is on how to exercise with MS, specifically as it pertains to how much should you be pushing yourself or not pushing yourself. I did a lot of research to prepare for this episode today. And I always do research for all of my episodes just to make sure that I am sharing the most updated and accurate information with you. But this topic in particular, I was really trying to play devil's advocate with myself and find proof that there is some evidence behind muscle failure. So I'll share with you what I learned, but I'm also going to be sharing with you just what I've known from research in the last 12 years that I've been a physical therapist and specifically working with people with MS and the success that they have seen from using one of these strategies. So let's start with where this idea comes from. This idea of training to muscle failure isn't random, and it's actually used a lot in traditional strength training, especially for healthy athletic populations. It's sometimes used to maximize hypertrophy, which is just a fancy term for muscle growth. So, again, in those healthy populations, especially for people looking to build muscle and to look stronger, not just be healthy and get more active, but actual muscle growth. The muscle failure technique is something that is commonly used. So that's why you might hear personal trainers or maybe even social media influencers talk about pushing your muscles to failure because it is a common tool in the strength world. But here's the thing about multiple sclerosis. As we all know, with MS, everything changes. And each person living with MS is so different. We know that it's called the snowflake disease. There's no two people with MS that have the same exact symptoms or journey. And therefore, no two people should have the same exact exercise program. But as we're talking about fatigue versus failure, fatigue is a huge part of multiple sclerosis. There are stats showing that up to 90% of people with multiple sclerosis have some level of fatigue. And fatigue isn't just getting tired, it's neurological and it's unpredictable and it can deeply impact your ability to recover from exercise. Even when we're not talking about exercise, I would say almost every missing link member that I have and every client that I work with has fatigue even when they're not exercising. But for this episode today, we're specifically relating it to exercise. Another thing to keep in mind about multiple sclerosis is that form and quality matters so much more when we are retraining patterns and supporting your nervous system. If you're so fatigued that your form falls apart or your quality isn't as good. You're not building function, you're actually reinforcing dysfunction. And so, again, kind of going back to a healthy individual versus an individual with MS, or honestly, any nervous system dysfunction, the goal is different. In one, the goal for the healthy individuals, the goal might just be muscle growth. For MS, oftentimes the goal is muscle growth as well as improving your function. It's muscle growth so that walking is easier, or it's muscle growth so that balance is easier and you trip less, muscle growth so that you can climb stairs easier. So, 9 times out of 10, at least with the patients that I work with, that muscle growth is tied to a specific function or activity. And if you're so fatigued when exercising that your form falls apart, we need that form to reinforce function. So, if your form is falling apart, you're just reinforcing bad movements, bad habits, and dysfunction. And also, let's just be honest, for the majority of us, pushing to failure when you have MS symptoms like foot drop or balance issues or sensory changes, it's not just unhelpful. The majority of the time, it's also unsafe. But let me take just a small step back here and explain what I mean when I say muscle fatigue versus muscle failure. So, muscle fatigue is a gradual decline in the muscle's ability to generate force during a sustained or repeated contraction. And it's characterized by progressive weakening over time, right? That's something that we all experience as we fatigue, that it kind of gets worse and worse over time. We feel a little bit weaker and weaker as we continue to go. It also is characterized by the ability to still perform the movement, but with decreased strength or endurance. And oftentimes, recovery occurs with rest, oftentimes within minutes to hours. And last but not least, but muscle fatigue, you can continue exercising just with reduced capacity. So I'm going to do a quick recap of that again. Muscle fatigue means progressive weakening over time, but you're still able to perform the movement just with decreased strength or endurance. Recovery does occur with rest, likely minutes to hours. And again, you can continue exercising just with reduced capacity. Now, we're comparing that to muscle failure. Muscle failure, when you're exercising, means the complete inability of a muscle to produce enough force to complete another repetition with proper form. So, muscle failure is the complete inability to move the weight through the full range of motion. Or even if you're not using a weight, it's the inability to do another repetition of whatever it is that you're doing. It is the absolute end point where no additional repetitions are possible. So, muscle fatigue, you can keep going, but you might not be lifting as high. Whereas muscle failure, you can't keep going. You cannot do another repetition. The typical progression, and this isn't true just for people with MS, just for everyone, the typical progression of how fatigue sets in when you're exercising is first, normal function. You're totally fine. You're going, you're moving, you can do your exercises. And then eventually you hit the onset of fatigue, which is when your muscles are working harder but they're still functional. You can still do the exercise. And then it's progressive fatigue. So there's increased difficulty, slower movements, and then you hit muscle failure, which is, again, complete inability to continue. So there are some programs out there that are apparently advertising that if you have MS, you should be exercising to muscle failure. I'll be straight up with you. That is absolutely not what I teach. And I'll tell you why later. But before I do, I just wanted to share with you what the research shows on this specific topic. And as I mentioned earlier, I tried hard. I dug so deep in research to try to find anything that said that people with MS should push to muscle failure. And at the end of the day, I couldn't find anything that said that. I did found some important stats that I'm going to share with you, but I just couldn't find anything. So if you are aware, if you're one of those people, maybe you're participating in whatever course this is that reinforces muscle failure, and you know something I don't know, please send it to me and let me know. But I couldn't find anything. But what I could find was that the clinical guidelines suggest moderate resistance training using submaximal loads. So, what that means is that, and what the research showed is that if you have MS and you're doing resistance training, they recommend starting at about 40 to 50% of your one rep max, and you would progress to 50 to 80% of your one rep max. If you are not used to the strength training world, I'm going to try to break it down for you in a different way. So, one rep max is, let's just use the example of a bicep curl. A one rep max is how much weight can you possibly lift for one repetition. If you only have to do it once, how much weight could you lift? So let's say, I'm just going to pick a random number here. I don't know what my one rep max is for really any exercise right now. I used to back in college when I played soccer. We had to know our one rep max for lots of exercises. But let's just say for a bicep curl, just to make numbers easy, let's say my one rep max or your one rep max is 50 pounds, meaning for one repetition, you can hold on to a 50-pound weight and do a bicep curl. That's not what you should be doing for every repetition, but rather you should do 40 to 50% of that when you're starting out. Meaning, instead of doing 50 pounds, you would want to do repetitions of 25 pounds or less. And then as you get stronger, that's when you could progress to 50 to 80% of that one rep max. So that would maybe be 25 pounds to, I'm not good at quick math, but whatever 80% of 50 pounds is. So that's what the clinical guidelines suggest starting at, is the 40 to 50% and then progressing eventually your way up to 50 to 80%. The sweet spot in terms of exercise for people with MS tends to be 1 to 3 sets of 8 to 15 repetitions. So we've got our weight that we're doing bicep curls with. We're going to do anywhere from 8 to 15 repetitions, and then we're going to stop and rest. That's one set. And then we're going to do another 8 to 15 repetitions, and then we stop and rest. That was set number two. Then we do another 8 to 15 repetitions, and then we stop and rest. That was set number three. We move on to something else. This research also showed that instead of focusing on reps and that the quantity, focusing on quality of the reps or the repetitions. So quality over quantity, which if you are in the missing link, or even if you just follow me on social media, that is what we preach, is quality. And again, I mentioned it a bit earlier, I'll mention it in a second as well, but quality is how you can not just get stronger, but get stronger so that your daily activities feel easier and that you have better, easier movement with things like walking, getting in and out of the car, stair climbing, getting up from the floor, etc. This same research also shows that training can include 8 to 10 exercises that target muscle groups that are important for everyday function. So, to recap, 8 to 10 exercises. For each of those exercises, 8 to 15 repetitions per set for 1 to 3 sets and at least 2 times per week. In the research that I've done, which again is extensive, while I did not find anything that supports pushing to muscle failure, what I did find is that rest is emphasized. And nowhere in the literature does it say to train to failure. However, it does say that rest needs to be part of your exercise. It also said that training to fatigue is often flagged as a risk, not a benefit in clinical populations. Now, when it comes to when to rest, this is where We don't have super clear evidence. There's no one guideline that says, okay, you should rest right before you hit fatigue or right after you hit fatigue or 3 reps later. There's nothing specific like that. And of course, it is going to be dependent on each person with MS and how it is affecting your body. But there are some guidelines that show that resting between sets can be a great strategy. Specifically, one resource quoted a few different articles that suggested resting for 2 to 4 minutes between your strengthening, your resistance training, exercising. But the Canadian guidelines showed it to rest for 1 to 2 minutes. So 2 minutes is kind of the common denominator there. I would say at least 2 minutes of rest between your sets that you're exercising. Additionally, the same research showed that there should be 1 day of rest at least between resistance training sessions. So, strength training, resistance training. But the strength and resistance training sessions can be performed the same day as aerobic exercise, depending on your tolerability. So, again, in terms of rest, we're thinking resting for about that 2 minute mark between sets and having at least 1 day of rest after you're doing your strength and resistance training sessions. Now, that 1 day of rest could mean that maybe you focus on stretching that day, or maybe you focus on a different body part. It doesn't mean that you need to literally sit on the couch, but you need to be resting those muscles that you just worked. Overall, what the research had to say about rest is that when dealing with multiple sclerosis, the most common recommendations were more on the conservative side of things. So, longer rest periods than typical fitness guidelines. Also, staying flexible in terms of what type of exercises you do each day. And then also being safety focused and making sure that you are resting enough so that you're not putting yourself at a risk for not being able to walk later that day. With that said, what I did find, and I was also previously aware of this, is that we're not saying, and research evidence is not saying avoid fatigue, right? So it is saying don't push to muscle failure. But what it is also saying is that you can do intense forms of exercise. So we're not saying avoid muscle fatigue, do yoga instead, which yoga, by the way, can feel very intense. But what research shows is that there's two specific types of higher intensity exercises that are beneficial for people with MS, such as high intensity interval training and high intensity resistance training. So, high intensity interval training is when you're doing any exercise. It could be lifting exercise, it could be a cardio exercise, could be anything, but it's something that feels high intensity for you. It feels like you are working hard. And then you have a different exercise that feels much lower intensity and you essentially go back and forth. And there's different parameters depending on what program you're following. You could do your high intensity movement or exercise for 30 seconds, and then your lower intensity exercise for a minute to recover. And then you go back to the high intensity movement, and then you go back to the lower. And you can have a bunch of different high intensity ones. You can have a bunch of different lower intensity exercises and just kind of pick and choose. But the general idea is you go back and forth between high intensity and low intensity, and it's called HIIT training, high intensity interval training, HIIT. So that we know from research for years is a beneficial type of exercise. Again, you're not pushing to muscle fatigue in those exercises. You are still focusing on repetition quality, not just the number of repetitions. And you're focusing on how much you can tolerate and resting when needed. The other type of higher intensity exercise that we know is helpful for people with MS is high intensity resistance training, also called HIRT, HIRT. So we kind of already discussed this one a bit, but just to reiterate, high intensity interval training is when you're doing 70 to 80% of one repetition maximum. So again, if we go to that bicep curl and our 100% max for one rep is 50 pounds, then we would want to do 70 to 80%. So you're still not pushing yourself 100%, but 70 to 80% of that. And what the research shows specifically for MS is that doing high intensity resistance training can show significant improvements in muscle thickness, therefore muscle growth, as well as functional capacity, which means your ability to do your daily activities easier, and reduced axonal damage markers, meaning reduced damage to the axons in our body, in our brain, in our spinal cord. Additionally, this type of training showed reduced fatigue scores in people experiencing MS related fatigue and improved strength, mobility, balance, and fatigue. So I hope that when you hear me say that there's no research that supports exercising to muscle failure, that you're not confusing that with meaning that therefore you should just do light exercise. Of course, you can exercise lightly. I'm a huge fan of that when that is needed, but you also can do high intensity training of kinds. You just don't want to do so intense of exercises that you are pushing to muscle failure with those repetitions. You want to be resting, you want to be focusing on quality. And in case you need a refresher, I talked a little bit in the beginning about healthy individuals versus individuals with MS. And what I see frequently is that with healthy individuals who maybe have an injury. So, as a physical therapist, I used to see, prior to being an MS specialist, I would see patients all the time who had low back pain or a knee injury. And their goal was to get stronger. But for them, their goal was to get the muscles stronger. And that is an orthopedic physical therapy approach, or even a personal trainer approach is to get the muscles stronger. But with MS, while you might be healthy, your nerves are not healthy. More likely than not, they are demyelinated. So when you have weakness from MS, it is vastly different from weakness that a healthy individual or an individual that doesn't have MS is experiencing. If you don't have anything affecting your nerves and the connection between your brain and your muscle, AKA your neural pathways, then traditional strengthening exercises are fine. But when you have MS, the reason that you have muscle weakness isn't just because the muscles are weak, like a healthy individual. The reason is because your nerves are not responding in the way that they should be. So, your strength training routine needs to focus on strengthening your nerves and that connection between your brain and the muscle. And when you do that, your muscles will get stronger, but it's a different approach. And that approach is functional exercise and neuroplasticity. I preach this from the rooftops. So, unless you're brand new to listening to my podcast, I really hope that this is not the first time that you're hearing about neuroplasticity or functional exercise. But one of the most powerful things we can do for MS is promote neuroplasticity, which is your brain learning new ways to move and to strengthen your muscles via strengthening your neural pathways. Or I like to think of it as like your Wi Fi connection between your brain and your muscles. So, neuroplasticity, there's lots of different techniques we can do. I have a few different podcast episodes on neuroplasticity. If you're in my online program, The Missing Link, we have videos on neuroplasticity in there, and every exercise utilizes neuroplasticity concepts. But for the purpose of this episode, where we're discussing muscle failure versus muscle fatigue and what to be doing, what's important to know is that neuroplasticity thrives on good quality, consistent, intentional movement. not exhaustion. So when I recommend stopping before you hit fatigue, or if you do hit fatigue, stopping shortly thereafter, it's not because I don't believe in pushing yourself. It's because I believe in rewiring your brain in a way that's functional and actually improves your daily movements and activities and that's sustainable. And I also hope that this gives you a permission slip if you've ever felt guilty for not going all out, please don't feel guilty. Going all out isn't the goal. Going forward is. And that might mean stopping at 8 reps instead of 12. Or maybe your first set is 12, but your second set, when you're a little bit more fatigued, maybe you stop at 6 because you can do 6 really good quality repetitions and then you stop. And then your third set might be 5. Fantastic. It might mean resting more than you think you should. Progress with MS is so, so personal. And it's not about matching your exercise routine to what someone else is saying, even the guidance that I'm giving you. It's about listening to your body and working with a plan that's actually built for you and that feels good for you. So, if you've been following someone who encourages exercising to the point of muscle failure or failure training, first of all, I would encourage you to ask them where they found the research that supports this. And also, if it's not feeling right, this is your permission slip to rethink it and know that there are other ways. If you are type A like me, it can be very easy to feel like you need to go big or go home, and you're not going to see better strength and bigger muscles and better results unless you go all out. But that fortunately is not the case. And especially when it comes to MS, there's often better ways, safer ways, smarter ways, more effective ways to build strength with MS. And I would love to help you find that. So I hope this conversation just kind of opens your mind on the different types of theories behind exercising with MS. If you do want to work with me or even just learn more about my approach, my online program, The Missing Link, is going to be the place to go. This is where I fuel my members with everything that I know about MS specific physical therapy. I give daily guidance on exactly which exercises to do each day to help you reach your goals, including modifications. We have lots of opportunities for you to get your questions answered. And we bring in other MS experts monthly, like neurologists or registered dietitians. So you're getting a well rounded approach, not just only focusing on one small piece of your journey with MS. So I will put the link for the missing link down in the show notes or the description so you can learn more about it, see if it's a good fit for you. In the meantime, I'd love to know your thoughts on this episode and if you found it helpful. So reach out and let me know.